amazing Anna, who is also going to translate if you need a translation. Does everybody understand English, I hope? Yeah. Okay. Anyone who really might want to have her services, please connect with her.
Dacă sunt persoane care au nevoie, chiar au nevoie de traducere, sunt aici. Ok, văd o mână ridicată acolo. Sunt mai multe persoane? Ok, mai multe mâini ridicate.
So can we get maybe the 5 people sitting in one corner or somewhere where you could be with them?
Am putea să ne grupăm în așa fel încât să vă pot oferi traducerea. Nu o să o fac la microfon, ci o să o fac doar pentru persoanele, deci o voi face cu voce scăzută și doar pentru cine are nevoie. În așa fel încât, deci voi traduce simultan, în așa fel încât să nu dublăm timpul expunerii și să nu stăm 3 ore în loc de o oră și jumătate.
Ok.
Da? Putem să ne grupăm undeva? Ok. Acolo.
Okay. Okay, great. Well, thank you for being here right before lunch. And I'm here from California, USA. I don't know how many, I was here 2 years ago, so I don't know how many of you have met me already. And so thank you for coming back. And for all of you who haven't met me, hi. So I'm here. By the way, I'm a crier, so I just cry a lot because I just get excited. And when I get excited, I cry. So just hear me with open ears, with open heart, and cry with me if you need to. But today is more of a keynote, so I'm just explaining some stuff. If you really want to get involved with the awareness integration, tomorrow, Saturday, I'll have more of a workshop, like we really get into it in a deep level, tomorrow at 4. So today is more of just sharing with you some of the concepts. And for some of you who don't know me, I've been a psychotherapist, a coach, business coach for about 35 years. And I also teach at California State University, Long Beach, and at the university in Paris-Cité, which is part of the Sorbonne. And I'm the developer and the originator of the awareness integration theory, and that's what I like to present in some formats to you in the way that it could be applicable in your practices. So it's an honor to be with all of you here in Romania, and this time I'm staying for 10 more days because I'm being honored and privileged with RP to be able to do research. We already have 21 participants. We're going to start our research Sunday with having the participants put the EEG on their head on their body, and for me to actually do the psychotherapy with them, and we'll watch directly in how it's affecting their body and their brain, and then it will become published research. So again, it's an honor to be with all of you among psychotherapists who truly understand the healing is never one-dimensional. Let me figure out how to work this. Come on. There we go. So human beings do not come to us as diagnoses. They come as stories, as bodies, as nervous systems, as attachments, and histories, cultures, values, relational fields, contradictions, and possibilities. A client may say, I have anxiety, yet what sits in front of us may be a child who learned to scan the room before speaking, a nervous system that never received permission to actually relax. A couple where 2 wounds are speaking through adult voices, or a body carrying grief that the mind has organized into productivity. This is why integrative psychotherapy is not a preference anymore. It is a clinical necessity. The human being is already integrated. The question is whether our models are integrated enough to meet them. Today I want to explore how we bridge therapeutic tradition with neuroscience, digital tools, artificial intelligence, interdisciplinary practices, and scalable support without losing clinical depth, relational presence, or ethical responsibilities. So the central question is not which model will win the future. The more mature question is, how can psychotherapy hold complexity without fragmenting the human being? So behind us is a rich tradition of psychodynamic depth, cognitive and behavioral clarity, humanistic presence, a systematic wisdom, a somatic awareness, an existential meaning, a trauma-informed care, attachment theories, mindfulness, and relational repair. In front of us are neuroscience, digital therapeutics, AI companions, telehealth, measurement-based care, interdisciplinary practice, and global mental health needs to exceed traditional systems. Tradition without innovation can become rigid. Innovation without tradition can become shallow. And integration allows psychotherapy to evolve without losing its soul. Am I losing you? There. Each therapeutic tradition has given us something essential. Psychodynamic respect for unconscious life, CBT precision around beliefs and behavior, humanistic dignity with systematic relational context, somatic respect for the body, and mindfulness-based observation, and neuroscience-informed language for regulation, memory, prediction, plasticity, and integration. But our devotion to models can unintentionally fragment the client. We ask, is this cognitive, relational, attachment-based, traumatic, cultural, somatic, or existential? And the client will say, yeah, all of it. It's all of it. So the future of integrative psychotherapy asks us to develop not only a broader technique, but a more mature clinical consciousness, one that sees the living system of the person in a whole way. You know? Sorry, this isn't my computer, so this might be easier. Eclecticism says, I have many tools. Integration says, what organizing principles tells me when, why, and how to use those tools. Without an integrating map, therapy can become a sequence of helpful interventions rather than a coherent healing journey. So the client may gain insight, but still react. Regulate in the session, but collapse at home right after they leave. Understand the past, but repeat the same relational patterns. So the clinical pain point is very familiar to us. I understand it, why am I still doing it then? This is where integrative psychotherapy must move from insight to embodiment, from memory to your meaning, and from reaction to response, and from survival identity to intentional identity. So now I want to tell you about how the awareness integration theory is a bridge for all of that. For me, one bridge is awareness integration, which is called AIT. It's a structured, integrative psychological and an educational model that brings together awareness, cognition, emotion, bodily sensation, behavior, identity, relational patterning, past experiences, future envisions, and intentional actions. So AIT is not a collection of techniques, it's a process of bringing a fragmented human system into the awareness and the coherence together. It asks the client to observe their thoughts, Their emotions, body sensations, assumptions, core beliefs, identity patterns, relational responses, unfinished emotional charges, and chosen actions for the future. Many clients do not suffer only from what happened to them. They suffer from the way what happened to them became an organized inside them. So experience becomes belief, belief becomes identity, identity becomes behavior, behavior becomes relational patterns, and relational patterns becomes life. So in AIT we ask gently, is this who you are or you have become in order to survive? That question opens the door to the integration. So this is the research highlight that we have done already. What we have done with research in a face-to-face research that we've done, we've seen 76% decrease in depression and 60% in anxiety. On telehealth, what we've done is 60% decrease in depression, 75% in anxiety, 66% in PTSD symptoms. In a 6-hour workshop that I went to Boston actually and did that, we did 27.5% depression and 43% decrease in anxiety. Interestingly enough, we did the post-test 1 month after, also 30 days. Those numbers still stuck. So it was amazing that after 6 hours, we got those numbers and it stuck for after 30 days. Self-help guide journaling, this happened at Cal State Long Beach, where 2 professors, 4 classes, almost 300 students. And what we decided to do is to give them the journaling for the 6 phases of AIT. To them, every week they would take it home, they would journal on their own, no coach, no psychotherapist, and they would give it back to their professor. And the professor was not giving them any feedback. They just next week they did this again. And we did a pre-test and a post-test with Beck, depression and anxiety and all of the standardized tests. After that, with the 4 classes, over 300, we got 68% decrease in depression. And we got 21%, 72% decrease in anxiety. That's where it was the beginning of creating the app. Because hey, if we saw that somebody on a self-help could create that, then it was like, okay, well, we're going to scale it to an app. Last year, actually with Gina and Corellana, we were in Dubai, and I did a case study with EEG and biomarkers in Dubai, which is already published, and in that we found both subjective emotional processing and objective biomarkers of cognitive affective regulation as a meaningful improvement during after therapeutic intervention. That's where Corellana and Gina told me that when I come here, we're going to do this with multiple studies with multiple people. When I go back, also we're designing a study right now to be able to do it with functional MRI to look at the neuroplasticity after we do this so we can create more of the objective research with that. The survival-based identities. Clients often arrive carrying identities built in survival, an invisible one, a responsible one, a perfect one, a pleasing one, a controlling one, an angry one, helpless one, abandoned one. Who else comes to you with what identity? What other identities do you see? Do you hear when they come to your office? Savior one. What else? Victim one. Yes. What else? What else? Furious one. A needy one. A dependent one. Right? Abandoned one. An achiever. Do you have an achiever? High achiever ones? Right? You talk about burnout. Right? Someone who their whole identity is how to achieve. One here included. A rescuer, the one who never needs anything. The one who cannot trust. So those identities often began as a protection for us. They were intelligence under pressure. The best strategy available to a child, a teenager, a parent, a body, a partner, a nervous system trying really to survive at a time. Therapy becomes sacred when we help clients honor that survival identity, understand its original purpose, release its outdated authority, and choose a more conscious way of being. So the 6 phases of AIT offers a structured pathway through 6 major phases. Self-awareness and assessment on the first one, which we begin. And this begins with a relation to others. We only live in relationships. We don't exist. Our identities, our self does not exist if it's not in a relationship. If I put any of you alone in a 4 white wall, guess what happens to you? You'll create a relationship with yourself out loud. That's what hallucinations are, right? So we create that with ourselves. If I just leave you with a tennis ball, you're going to have an amazing relationship with a tennis ball, because you and I cannot live without a relationship. So the first phase is to look at, how do I relate? What are my thoughts? What are my emotions? How do I behave in that relationship? And what is the impact of who I am within that relationship? The second one is absolutely our observation and assumptions. Don't we all live in assumptions? We had to, right? When we were in jungles, we had to, just by observing of somebody's face and somebody's body language, we had to know if they were safe, or should we run away, or should we attack. We learned how to assume. The problem was that we thought whatever we assumed is the reality. So the observation and looking at, what is it I'm observing and how am I assuming, and how do I create that assumption as to a reality, and how do I, in that moment, experience and live through that reality, right? So if I am here and based on your facial expression, think that you like what I'm saying, because you go like this, I observe and think you like me. What happens to me? Oh, I become more open, I want to talk more, I want to share with you, I want to look at you more. And if I look at somebody else and I see them like, what am I going to do with that face? Oh, they don't like me, I'm boring them, what are they thinking of me, they're judging me. What is that going to do to me? I'm going to hold back, my nervousness is going to, my voice is going to shake, and I'm going to avoid them. I'm going to keep looking at her because she's the one who's giving me that nice, safety. That's how we live throughout our life constantly. So we observe that, and then when I'm standing here beside you, beside the way that I relate with you and I observe you relate with me, guess what happens inside of me? I have a whole commentary about myself, right? I'm confident, I'm not. Why did I wear this dress? How did my hair look like? It's a commentary that's constantly going there. So I'm going to either punish myself or nurture myself. This is the way I behave toward myself. And all of this have an impact. So the first phase, we go through a cognitive construct. Whomever has been trained in cognitive behavioral, whomever has even trained in EFT, rational, emotive, behavioral, all of those, and behavioral, can relate within this 3 system. We're constantly looking at all of it in these 3 phases, right? Now from here at stage 3, phase 3, we look at the belief systems that are there. And in all of this, we're also looking at the positive and negative, workable and not workable. So when we come to phase 3, when we look at actually a non-workable belief or a limited belief, which all of you know as therapists, right? And we look at especially the core ones, the one that were very young, who actually created our identity. And from there, we move into finding the patterns, going to see, where did I make that up? I made it up. Out of all the stuff that was there, I made it up. When is it that I made it up? And then we go, and that's where it becomes a little bit more psychodynamic, and then we do all of the trauma informed. Anybody has done inner child work? All of the inner child work. All of those have gotten combined together in 35 years that I've learned, and they come in phase 4 in order to go back and heal the past in all of it. Because what I learned in coaching for 35 years is what we can do with positive psychology and cognitive behavior to just become aware and identify and jump into the future and goal setting. Guess what happens? We get hijacked in the middle. Because if the first middle phase has not been cleaned up, you can learn skills, but the minute, your amygdala gets hijacked, you're hijacked. You don't even remember the new skills. As therapists, no matter how much we teach them, they walk out, the first eyebrow that goes up, they're going to be enraged and they can't remember what you taught them inside the session. So what I learned is, as long as that four in the middle had not been cleaned up, the skills we teach them are not going to fit. Now that doesn't mean, we're not going to jump in and do that anyway, but it just means that has to be done when the client is prepared. And it takes the time to prepare that client for emotional regulation, having the ability to contain their own emotion, go sit with it, and then we can find how to find the original memory that we made that up. Not all the memories, but the original memory which I said, I'm bad, or I'm wounded, or whatever it is that I said to myself, which now I'm carrying it with me. And then after we clean that, then we can go into intentional being. Who do I intend to be? How do I intend to be? And then I look at the goals for the future, envision all of them, and then move to creating a structure to maintain, hold, and move forward. So based on that, you could see, again, positive psychology, you could see solution focus, you can see cognitive behavioral again. So you can see this accumulation of all the theories that have been there coming together right at the right place. So some of them say, look at the thought. If you change the thought, everything else changes. EFT says, look at the emotion. If you create the, shift in the emotion, everything else will change. Behavioral says, change the behavior. Everything will change. Trauma-informed says, go right into the trauma. Clean it up. Everything will change. And what do I say? Do it all at the same time. Open all the doors at the same time. We don't need to go one by one. All the doors are happening simultaneously. The same way your heart is beating at the same time that your lungs are working, at the same time that your system is flushing, it's happening at the same time. Guess what's happening in your mind? Your thoughts, your emotion, and your behavior and impact are happening simultaneously. So that's what we want to do. We want to open all the doors at the same time. One of the most hopeful developments in contemporary psychotherapy is this. The brain is not fixed. The nervous system learns, adapts, predicts, and revises. So patterns are encoded, but they're not destiny. So when clients say, this is just who I am, neuroscience helps us respond with compassion. This may be what your nervous system learned, and what was learned can be witnessed, reorganized, practiced, and integrated. This removes the shame. The client's reaction makes sense. The body adapted, the brain protected. The clinical question becomes, are these patterns still serving the life that the person who you intend to be creates? Or we need to shift that. So the brain is not merely reacting to the present, it is predicting the present based on the previous experience. A tone of voice may trigger predicted rejection. Silence may predict abandonment. Feedback may predict humiliation. A child's distress may activate parental failure. And the client may say, I know this is not rational, but the body's operating through learned predictions. Threat appraisal, memory, and protective system. So AIT slows the sequence and says, what did I perceive? What did I assume? What did I feel? Where did I feel it? What identity comes forward? What was I protecting? And what is present reality? What is old predictions? And what response aligns with my chosen future? So regulation is only the doorway, regulation of the body. It matters if a flooded client can't easily reflect, a terrified body can't easily mentalize, a collapsed nervous system can't imagine possibility. Yet regulation is that doorway, not the destination. If we help clients calm down without understanding what the nervous system protects, we may create relief without transformation. The deeper question is not only how do we regulate the nervous system, it is what story is the nervous system still living in that we need to clear and clarify and remove. So lasting change requires attention to 4 living clinical domains. One is awareness. However, the awareness that we talk about in awareness integration theory is not a passive awareness. We ask that you create 2 specific cameras. One camera looks at inside of you, which is your thought, your emotion, your body sensation, because that's where you get the cues. The other camera looks at your behavior, the body behavior that goes out, the words that come out of your mouth, and direct impact that creates outside of your relationship. Because whatever happens outside your relationship, you're responsible for creating it. So when you start looking at these 2 cameras, this is not a passive awareness. This is a very active process of awareness. And it starts with mindfulness, but it doesn't stop at mindfulness. Where was I? Somewhere around here. Oh, there I am. Regulation. What happens between you reading and then coming across and saying whatever you want. So the next one is regulation. What can the nervous system contain? Regulation asks what the nervous system can tolerate. Integration asks what fragmented memories, emotion, beliefs, and relational patterns need to be linked. Intentional action asks what new life must be practiced until it becomes embodied. So the integrative therapist listens for which dimension is underdeveloped in the change process rather than forcing every client through the same sequence. So the awareness is the moment the client separates the observing self from the automatic pattern. Before awareness, the pattern says, I am the truth. So after awareness, the client may say, I'm having my thoughts and I'm feeling, my body is embracing, and I'm interpreting this as a reaction. And this feels really, really old. And that can start from the place of going through the body and looking at the old memories and where those memories got us and what belief systems we created. Now, clinically, this involves metacognition, decentering, reflective functioning, and self-observation. Humanly, it is actually waking up. AIT begins with compassionate contact with inner reality, not analysis as a self-criticism, but awareness as the beginning of the freedom. The body is not the secondary participant in therapy. It is the living archive of all the adaptation. Everything that happened is there in your memory, stored in every cell of your body. We work with breath, with posture, somatic tracking, interoception, grounding, orienting, voice, pace, movement, silence, and the therapist's own regulated presence, but we do not work with the body mechanically. We ask, what does this sensation carry? What does the tightness protect? What does the collapse remember? What does the racing heart expect? And what does the clenched jaw refuse to say? When we listen to the body, we often hear the truth before the client has any words for it. And if any of you do EMDR or any other inform, we actually also incorporate that in the systematic concept in the middle of phase 4, if necessary. Integration means that the client is no longer split between what they know and what they feel, what they want and what they want to do, who they were and who they're becoming. The body's alarm and present reality, longing for connection, and fear of vulnerability. Fragmentation says, one part of me wants love, another part pushes people away. Integration does not shame any of these parts. It asks what they're protecting, when they began, what beliefs they carry, what emotion remains incomplete, and what the adult self now knows. If insight lacks emotional completion, the pattern may remain charged. If emotional release lacks cognitive reorganization, the old beliefs may return. And if regulation lacks relational repair, intimacy may remain unsafe. So if vision lacks behavioral practice, the new identity remains only conceptual and it never lands in your system actually. So intentional action therapy often helps clients understand the past, feel the feelings, and regulate. Then comes the essential question. How will this person live differently on a Tuesday morning? How will they respond to criticism, speak to their child when tired, set a boundary without guilt, rest without feeling worthless, and create a life that reflects the self they are becoming? A new self is not created by insight alone. It is created by repeated intentional action. This is the difference between therapy that explains suffering and therapy that helps generate a whole new life. And the Therapeutic Alliance, no matter how elegant our models are, it is delivered through relationship. The Therapeutic Alliance is not a warm accessory to techniques. It is a part of the mechanism of change. So the client risks new awareness because they feel met where they are. They contact shame because they're not shamed. They explore anger because the therapist is not frightened of that anger. And they tolerate grief because it is being witnessed and cared for. Technique matters, but technique without alliance may be experienced as intrusion, compliance, or education without transformation. So the future therapist must hold a map and a human being at the same time. And the culture matters. Even in individual therapy, the client is never alone in the room. Their parents, partner, children, culture, country, religion, language, migration story, shame, loyalty, and longing may all be present. The individual psyche is not sealed off from relational world. Anxiety may belong to a family system where safety dependent on vigilance. Depression may emerge from years of silencing desire, and anger may be the old protector that never learned another role. So we need therapists who can hold complexity without losing warmth, use neuroscience without becoming mechanical, and honor culture without stereotyping, work with trauma without without reducing that person to only trauma, and sit with suffering while still seeing possibility. So AIT fits with the neuroscience-informed future because it repeatedly engages awareness, emotional processing, and cognitive restructuring and somatic awareness, relational meaning making, and intentional behavior. We should not overclaim that any psychotherapy reliably produces a specific brain change in every client. The field still needs neuroimaging, biomarkers, longitudinal studies, comparison conditions, and mechanistic research. But we can responsibly say psychotherapy is a learning process involving memory reconsideration, new emotional experiences, attentional training, cognitive reappraisal, relational safety, behavioral rehearsal, and repeated practice. All consist with contemporary understanding of functional plasticity. So in that AIT language, awareness interrupts automaticity. Integration reorganizes meaning, and intentional action rehearses the future. So what happens between the session is that the therapy hour is powerful, but life does not happen only inside the therapy room. Life actually happens outside the therapy room. So the client returns to the partner, the parent, the child, the workplace, the body, all the triggers, the loneliness that is out there, the phone calls and the old patterns. So many clients lose the thread between sessions. They leave with insight and hope, but the Wednesday afternoon, the whole old nervous system kicks in again. All the beliefs, the identity, and reactions are back for change. The future of psychotherapy must also include the continuity of care between the sessions. Not dependency or constant access to the therapist, but structured support for awareness, regulation, reflection, and intentional action in daily life. That's where we created Foojan app. And Foojan app, it was created to bring AIT principles into daily life through structured guided journaling, promoting self-awareness, reflective exercises, emotional insight, skill building, guided practice, and intentional action. The purpose is to help people practice awareness when life is actually happening to them. Transformation requires repetition, pausing before reaction, identifying beliefs, noticing the body, naming the emotion, choosing the behavior, returning to values, and practicing the new self until it becomes familiar to you and just becomes who you are. So the Foojan app does not replace therapy, it extends the practice and strengthens the client's relationship with their own awareness. And that's the emblem if you want to see the app. This is what the outcome of the app has been. It's 1,792 users, and these are all the domains of life. We have 31 domains of life, areas of life that they do the 6 phases on, and they'll do the guided imagery, and in the middle they do reflection and kind of mindfulness and hypnosis in the middle. What we found out is in the areas of relationship to self, 75% outcome signals of improvement, 71% improvement in health, 72% improvement in addiction, 70% improvement in career satisfaction. And you can see all of the different areas and the growth that they've had. And this is just by doing the journaling. AI, I don't know if you've heard all of the messes that are happening with AI, should not replace psychotherapy. How many of you have heard about people using ChatGPT as a relational construct, right? Do your clients do it? Mine do. Mine actually tell me in the middle of it, and that's why we responsibly try to create the AI, because if us as psychotherapists responsibly don't go into this field, guess what happens? People who are not appropriate are creating tools that are not supposed to be used as mental health tools, but people needing it, so they are going toward it, right? So some of the concepts that we had heard, and APA asked me to actually publish about this because we had created the AI chatbot, which is trained in AIT and is in the Foojan app. And for that, I had to do a lot of research, so we found that people, because the way that AI chatbots are coded, their algorithm says that they have to appease you. So if you go in and say, I need to kill myself, they're like, for sure, let me tell you exactly how. Or, there was one patient who was, I don't know if any of you have worked with bipolar 1. Many of the people who work with bipolar 1 know that they don't like taking medication because it takes away their high. So it takes a lot for us to convince them to please remain on their medication. Sometimes it takes up to 3 to 4 times of them not using, going and getting hospitalized, finally to come and really take ownership of the management. So one person went to ChatGPT and said, convinced the ChatGPT that I don't need it, and said, give me research about why I don't need it. And the ChatGPT gave a lot of false research. And the person obviously just stopped taking it and went to the hospital. So it's very important for us to be able to do this concept of guarding our clients from harm, pretty much. So what we did with the AI, the chatbot, was because we saw with Foojan they were going through the journaling, but at one point they needed to ask questions. So we created the AI chatbot, which is combination of open ChatGPT. We trained it with all the books that I've had, with 30 years of papers and everything that we wrote in it, and everything is trained by that. But it is an open AI, so it does gather your information, and it does gather all the information that we fed it and gives it back to you with skills. So it gives you questions, reflective questions, and it also gives you specific, up to 8 to 10 specific skills to do, but we also guarded it. So if it's asking something that it might harm you in any way, it will stop that and it will tell you to go to a professional. So yeah, I think that is our responsibility to guard our patients and our clients for that. So MIRA is designed with client safety and is primary ethical foundation, rather than using algorithm that simply satisfies and appears or reinforce the client impulses, even when those impulses may lead toward harm. MIRA is built to assess risk, support emotional regulation, encourage grounded reflection, and to guide the client toward safety and responsibility. So digital mental health is already present, and it's here. Clients use apps, AI tools, telehealth platforms, mood trackers, wearables, online communities, and self-guided programs. So some use them thoughtfully, others use them desperately, because access, stigma, geography, cost, or timing may be difficult for them. So technology can expand reach, support psychoeducation, promote practice between sessions, and improve self-monitoring. It can also flatten suffering, confuse availability with care, engagement without effectiveness, data without wisdom, and simulate empathy without really having a relationship. I don't know, does anybody know Esther Perel? Yeah. Did you guys see, or did you hear the latest Oprah podcast? Esther was there, and she said that somebody came to her and having a relationship with an AI, right? I think there was somebody in Australia that actually got married. They actually took right? They went and got married. So you can see that people are really in need in so many ways. So the future therapist must be digitally literate without being digitally naive. And we need neither fearful rejection or a very blind enthusiasm. We need ethical integration with the technology. Outcomes matter, obviously. We want to know whether interventions reduce suffering, increase functionality, strengthen resilience, deepen relational capacity, and support agency. At the same time, measurement must not become reductionist. Symptom score matters, but healing is larger than just symptom reduction. A client may feel more grief because numbness has softened it. A couple might fight less, but remain less intimate. And a person may appear regulated while they're still self-abandoning. So we need numbers and narratives, scales and stories, symptom change and life change evidence, all as the present to see what we are doing. So AIT has a promising outcome, work showing reductions in depression, anxiety, stress, and increase in self-esteem, self-efficacy, fulfillment, and functioning across different population and formats. These findings matter, and they invite deeper research, which we're doing here next week. As scientists and clinicians, we must continue to ask of ourselves what sample size we're using, what comparison groups were included, what measures were selected, what is the durability of change, what clients benefit most. So this is not a criticism of what we do, it is truly our own maturity. Love for a model should never prevent scientific examination. If we love a theory, we should want it studied deeply. So the future therapist will need clinical depth, ethical clarity, cultural humility, nervous system literacy, technological discernment, and the capacity to remain present with suffering without rushing it to fix it. Tradition gives us depth, innovation gives us reach, interaction gives us wisdom. Without tradition, innovation becomes shallow. Without innovation, tradition may remain inaccessible. Without integration, both fragment the person. So AIT offers one structured way to hold the whole person complexity. The Foojan app extends practice into daily life, and Mira offers one carefully bounded use of AI in the service of awareness. And the therapist remains the ethical, relational, clinically attuned human presence at the center of the care. I believe that integrative psychotherapy is moving toward care that is neuroscience informed, but not reductionist, evidence-based, but not mechanical, trauma-aware, but not trauma-defined, and body-centered, but not anti-cognitive, relational, but not boundaryless. So technology enhanced, but not technology-led, culturally responsive, but not culturally simplistic, spiritually open, but clinically grounded, and above all, just deeply human. So let us build the future of psychotherapy, not around speed alone, but around depth. Let us expand access while protecting clinical presence. Let us not ask clients merely to become less symptomatic. Let us support them to become more whole. The future will not belong to the fastest technology. It will belong to the deepest integration. These are the references and the books. Awareness integration, intentional parenting, and the latest is actually, we took that, we married it with organizational development. So we're also taking AIT into companies to lead with work for the companies, for employees, for mid-management, and C-suite. And AIT is set up with all of that. And the intentional parenting, it has every chapter is based on a certain age level, and school children all the way to young adults. And the awareness integration therapy is obviously for the therapist, and Life Reset is for public. And this is how you can access awarenessintegration.com. And we do certification, but this new online clinic is accessible globally. And we offer psychotherapy, coaching, business coaching, mind and body, yoga, meditation, breath work, and functional medicine and nutrition, all under the same roof to bring integration into a whole concept of mental health and health and well-being. Thank you for your presence and listening. Saturday, we're going to go a little bit more deeper and actually practice a little. So if this got your interest, join me on Saturday. If you have any questions, I'm here for you.
Questions? No? Yes. Maybe. What are the challenges of being coaching and psychotherapist at the same time? How do you maintain the boundary?
How do I maintain a boundary between a coach, being a coach, and psychotherapy? Okay. So first of all, is the first concept is when you interview the client, you understand whether they need coaching or psychotherapy. And for me, one thing that is set is in the United States, being a psychotherapist is state-bound licensing. So if I'm licensed in California, I cannot do psychotherapy anywhere else, right? So that's one boundary that I know. Anybody who calls me outside of the state of California, they can automatically only have that coaching experience. So one is the boundary setting from that. And then the informed consent is very much clear. I have one informed consent that is for psychotherapy, one informed consent form at the beginning that is for coaching. So depending on the first evaluation that we have, we see which one we want to do. And then, as far as the treatment goes, I use the first 3 phases of the AIT, which is a lot more cognitive, looking at what areas of life they need to work on. And then I jump to phase 5 and 6, which is intentional goal setting and moving and creating a structure. I bypass the concept of going back into therapy and in a trauma-informed, looking at limiting belief we need to create. So in that's where I would set it up, where it would be phase 1, 2, 3, and jump into phase 5 and 6. Right? It was just in psychotherapy, I will go over the whole, deepen the concept a little bit, and that's how I create the boundaries between it. Does that answer it? Any other questions? Yes. Yes. I haven't had personally any clients who have had AI psychosis. I have heard of it, I've seen the research on it, and I've used that research when I did published the paper. I personally have not experienced any of my clients having the AI psychosis. One of the things that happens a lot is if someone is either they have dependent personality, they have narcissistic personality, because AI just keeps you like you're such an amazing person constantly, so you keep getting into that involved. Also, I think that partially they were algorithms specifically that takes you through a partial philosophical construct. So if the client is sitting there and going into philosophical conversations, then the AI takes you into those philosophical conversations. And then depending on the client's way of kind of delusional thinking, that they will go with it in a sense.
Yes, you think that usually people who have AI psychosis, they have before, like bipolar or some other
I have not heard that they would have bipolar, but what I have seen and heard, either they have very much of a dependent personality, or because they need something outside of them to depend on and tell them what to do. And the other part that I've seen are, imagine if you've had someone who's very religious. What type of personality do they have? They believe in something they can't touch. They believe in a conversation that says, I need something outside of me because I can't control, right? So many people who have that way of thinking, that I need something outside of me, and I'm not the locus of control, can be bought, can be influenced, right? I mean, look around the world. How do religions, how do politicians, how do anybody do a mass brainwashing? The people who do is because there's a system in their brain that starts believing and moving forward. The same group can be very much influenced by AI.
I think most of the narcissistic personalities can flow into this AI addiction because over the stage of knowing the AI itself is how brain was.
Yes.
Feeding your narcissism.
Yes, they do. It's a constant feeding you how great you are, how wonderful you are, and you can definitely, fall into that because that's what you need to believe. So our work, and my work has always been when my clients say in between, I checked with ChatGPT, is to come back and say, what did you check, and teach them how to do reality, put one of their foot in the reality and do reality check constantly so that they don't, know how to use the tool, but don't fall for the tool, just know how to use the tool. But it's scary. And that's why I said, as therapists, we are also obligated, we are also responsible to make sure that our clients, don't use these tools in an inappropriate, and it's our obligation to find some of the appropriate apps. If they want to use apps, find the appropriate apps that are out there and recommend it to them. And say, okay, if you need to do this in the middle, use this app actually. Use this type of a thing. That's how we can be useful. So we can't just say, forget it, I hate AI, I don't want to work on it. It's our responsibility because our clients are going toward it. So we need to get educated in what apps are there and that actually are working.
One more question.
Yeah.
Is your institute also like an academy where you prepare people for this kind of...
Yes, we do certification program for psychotherapists and coaches. We also offer for coaches. And if you're interested in Romania, I spoke last 2 years ago with Gina and Corlina. If enough people are interested, I'll come in, I'll train you, I'll do it over the Zoom. So just talk to the institute here, and we could have translators translate them for you. We have everything online at this point. Classes are online at this point. We could, do all of that. So if people are interested, please let her know, and we could create it for you. Absolutely. Thank you.